So, hi everyone, I'm Gilly Salmon, and I'm here today with some colleagues to talk about the peer enhanced e-placements. So, the peer enhanced e-placement, we call it PEEP. It started during the pandemic, but it's now been scaled up across all sorts of professions. And we're going to show you an example of one and what they're doing at the moment. So, over to you, Lisa, to introduce people.
Yeah, thank you, Gilly. I'm delighted this morning to welcome Deborah and Martin, who are both orthoptists from the Sheffield Teaching Hospital NHS Foundation Trust, and they've implemented their own PEEP and are doing subsequent work on their PEEPs to really develop the model for themselves. So, Deborah, we know you've implemented your own PEEP. Can you talk about what happened and then your evaluation, please?
Yes, first we attended the course for the PEEP acquisition package, and we realised through that within a very short space of time we'd got a placement coming up that would be absolutely ideal for the PEEP. So we had just less than 3 weeks to plan it, but fortunately we had the exemplar timetable and the handbook, and that made it so much easier to get it in place. Plus Martin's a very supportive line manager and was all up for it, and we had a go. We dived straight in with Sheffield University and the second year orthoptic students, and got on with running our first PEEP.
So what actually happened then when it was delivered to the students, Deborah? That intrigues most people.
Okay, yeah, it was quite an interesting experience. I think some of the students weren't quite sure that they were going to get that value from the that they would get on clinical placement, that some of them were quite reluctant. They were disappointed that they weren't getting full clinical placements. The students at the time were due to have 4 weeks of clinical placement, but there were only enough placements for them to go out for 2 weeks. One group went into placement for 2 weeks, and followed by the other group going in for 2 weeks. So we actually did.
That's what we call the hybrid model,
Yeah.
where you did turn and turn about. That's really interesting. Did it convince anyone that it was okay to do some of it online?
Yeah, it absolutely did. The majority of the students were really positive about the PEEP. We got some amazing comments in the feedbacks in week 1 and week 2, and the majority said that they really found it a valuable addition to a clinical placement.
Oh, that's interesting. When other people have evaluated, some people have said it was about the peer working. Others thought their reasoning was improved. Was that the kind of thing that your students said?
Yes, I think a lot of them really loved the peer group working. Some of them found that learning from their peers was really beneficial, and also to test their knowledge in that peer group situation worked really well. That was certainly one of the benefits that came out of the PEEP. One of the things that they really enjoyed. The students also enjoyed being involved in the PEEP, so we found that when we had like a journal club with a critical appraisal article, and we'd given them a critical appraisal tool, that sort of was always commented on quite highly. And also the simulations, which Martin can probably say a little bit more about the simulation.
Yeah, no, the simulations, the feedback was really good. So I think they really liked the fact that they could actually preempt and pre-plan and pull all their data together, and pull all their ideas forward, so that when they actually then came to clinic, they'd already got that in their mind, and that was really helpful.
Martin, can you explain what you what you actually did simulation wise?
Yeah.
Did it involve a lot of complicated technology?
Not particularly with the technology. So when they were doing their sort of review and all their case, they'd do a lot of searching for themselves with, literature that like Deborah had like asked them to go and find. They pulled all their thoughts together, and then with some of the simulations, they would then come back to their personal tutors, which I was one, and some of the other team members here were, and they would come and then they would actually try and gain history as part of the first sort of thing. So they would be asking all these history questions. And I know they all learn it in theory, but actually it just gave them that chance to put them almost in the hot seat a little bit to start directing those and actually observe how other people ask the questions as well. And then they could learn from those as like a cohort. So that was the first part of the simulation. Then we would actually provide them test results and test data. And then from that, they would actually have to analyze those, pull things together, do a bit of literature searching as well within their sort of peer groups, and then like formulate treatment and management plans. And towards the end, they then culminated in like a presentation of how they were managing that case, what they would do and how they would best sort of treat it.
So do you think this will impact on their ability to do it for real, both if they go on a location-based placement or ultimately when they're in work?
Yeah, no, definitely. So because it was the hybrid model, we had those two cohorts, one before they went on placement and one after. So my first thought was that they would probably benefit more in the first cohort. So in that first cohort, I was hoping they'd have it all in their minds so that when they sort of started, they'd be able to hit the ground running. And that was the case. It really helps.
Wow.
I was a little bit more dubious about it being the second sort of half, because I thought actually they've already sort of started doing it. However, there was some advantages because they sort of liked the fact that they could revisit cases that maybe they'd not actually specifically seen in clinic as well. So we had quite a range of mixes of, over this sort of learning outcome, I guess. It was very much diagnosis and management of a certain types of condition. And especially with COVID and the way that the clinical placements were, they weren't always getting all of those cases through. So the people that hadn't had those cases would have had that really good opportunity to work through those, so that hopefully in the future, if they do see them in clinic, they'll have that knowledge.
Sounds like a win-win that you've been able to widen the curriculum, but also the students have got, good learning out of it and slightly different kinds of learning. So I think you did a brilliant job on that. You told me you've got a few statistics now that from the evaluation.
Yeah, so I mean, obviously we had the formal feedback, but we also wanted to sort of gauge how people felt about it. So if with each cohort, before and after, we did some questions like with Google Forms. We just sort of sent them out to ask a little bit. And to be honest, like a lot of people didn't always see the value of it right at the beginning, but it was really nice to have that pre and post, and hopefully at some point we'll be able to share them all. We're trying to write it up, but it was definitely overwhelmingly positive. And that was from just perception of what they'd get out of it. And I think that has been really useful for us, because I think looking forward, there's quite a few other sort of learning outcomes on placements that this could actually be also really useful for. So it's something that we could almost implement in other settings.
Okay, so that's absolutely great. Thanks for that, Martin. I think that's very encouraging for others and for us also, because we can feed some of this back into the PEEP acquisition experience for colleagues. So Deborah, you told me you're working with some other colleagues now to support others.
Yes, we're in August we'll be doing the PEEP with the third year orthoptic students at Glasgow Caledonian University, and they're actually at a similar level to the students that we've already done the PEEP with, and so it's going to be interesting. Their course is slightly different to the one that we used to working with, and looking forward to that experience. It's going to be run mainly by our orthoptic departments. They've all been willing to jump in again and give it a go, and there'll be a little bit of input from the lecturers as well at Glasgow University.
Oh, thanks. So I look forward to hearing about that. So Deborah, any one tip from you for anyone who's considering an online placement?
That it's certainly doable, you know, particularly within a clinical setting. You know, quite a few of the PEEPs that I've looked at have all been more university based, but we've actually done this within a clinical setting. At the same time, we've carried through our clinical placements. Whilst we were running the PEEP, we also had students that were out on clinical placement. So it was quite nice. We had that comparison doing the hybrid PEEP because we had the same year of students in clinical placement, and you know, do our clinical work in the PEEP as well. So,
you've done an amazing job for your students, I think. Martin, anything you'd want to add to that?
Yeah, I think, you know, the good thing that we've managed to do is reach a lot more students as well. So normally on a clinical placement, we only have a set amount that we can bring through our doors at the same time. But with these hybrid models, we actually had, you know, a lot more on those hybrid sessions, you know, so where normally we'd only have had like 2 or 3 students, we actually had about 8. And in terms of time as well, it was actually quite time effective once it was all up and running. The planning took a lot of time, but once it was set up, like so some of the discussions, like we just knock off a patient at one point for those discussions, but then obviously we're meeting so many more patients, students, sorry, you know, we're reaching their needs. So whereas before it'd be more one-on-one, we'd have a larger cohort. So I think you can actually maximize your time slightly with it as well. But it's the prep time which is the hard bit, but I'm really hoping as they cycle and we see more of the same years come through, it's something that we can replicate and keep just slightly adjusting, you know, until we've got it perfect, or how we exactly want it.
That was always the idea, that, you know, once you've got the core design, that you can design once and deliver many times. And I will stay in touch and make sure that you can actually do that. So just my thanks to Deborah and Martin, and huge congratulations on what you've achieved. Just to go back to Lisa in case she's got any points to finish.
No, I agree with you, Julie. Well done to Deborah and Martin for being able to implement it at these, you know, these very challenging times, but also to recognise the longer term value of PEEP as well. And now to be working with wider colleagues as well is absolutely brilliant. So we'll be keeping in touch and be keen to hear how things are going for you both. Thank you.
Cool.
So
yeah, thanks.
Thank you very much from me. We'll put any links and examples underneath the video. So if you want to follow up with these amazing colleagues, I hope you will. So thank you very much for listening. See you next time.
Thank you. Bye-bye.